we are continuing our conversation about PANS and PANDAS, and what we are trying to show is that some of these various modalities can be used in a holistic and an integrative way to come up with a unique treatment plan for people, in particular children, as far as PANS and PANDAS is concerned. So today we're going to be chatting with Audrey. She is our clinical herbalist, and she is trained in traditional Chinese medicine. I will let her introduce herself.
Hi, my name is Audrey Barden Rossetti. I am a traditional Chinese medicine practitioner, focusing in clinical herbalism. I basically use herbal medicine to treat a lot of conditions, but PANS and PANDAS has been one that it has some really interesting correlations to traditional Chinese medicine theory. And so yeah, I'm just pretty excited to be working with a team that's looking at that in an integrative way.
So Audrey, one of the things that parents most often ask about herbs or traditional Chinese medicine is it safe?
Absolutely. All of these medicines and a lot of these herbs have been used for thousands of years, and they are definitely proven through science to not only decrease symptoms, but they're also not typically very addictive, and they don't take as much wear on the body. They're pretty easy to metabolize and all of that. So as long as you are in the care of a licensed herbalist, this is definitely a natural and safe option to explore.
Excellent. The other question that I most often get is that, are these herbs effective? Is there evidence behind it? Is there a science behind it? How do we know that this is not going to be quackery?
Yes. So traditional Chinese medicine has, again, because it's been here for so long, it's been able to treat a lot of cases over time and in different areas of the world. And so based upon that, and based upon a lot of clinical trials that have been done since TCM has become popular in the United States, and that actually started around 1970. We've had a lot more science come in and fill in some gaps between the thinking. So now we're able to use this like very ancient modality, and we're able to look at it alongside a Western way of viewing things, and finding that a lot of these things overlap quite a bit. And so the evidence is not only that it works, but it's actually compatible with other types of medicine, which is really quite remarkable.
And there's some Western oriented studies also that have been done on some of these modalities and herbs. And what really strikes me is that the traditional Chinese medicine system, it looks at the human body, it looks at illness, it looks at health from a very unique point of view. And even though that system of medicine comes from a totally different point of view, it can still be very effective. So one of the things I'd be interested to know, and maybe you can talk a little bit about it, is how does Chinese medicine look at illness, and in particular, how does Chinese medicine look at PANS, PANDAS, or autoimmune illnesses?
Yeah, so that's a really super interesting question. We like to think as TCM practitioners, we look at the way exterior pathogens, so that's, any sort of disease that comes in from our environment, we look at how it affects the individual once it hits the interior. So there are 4 levels when we're looking at warm pathogens, and PANDAS definitely falls under that category. It's kind of like a heat pathogen. It's going to enter through the top of the skin and the pores. That's the Wei level of the body. Wei literally means to protect. And so once a pathogen hits that part of the body, sometimes we start to see illness, colds, scratchy noses, eye issues, things like that, but still very 5 sense oriented, still very, very close to the body. Then as it starts to progress deeper into the interior, there's the Qi level. And with that, you'll get maybe more profuse sweating, some more severe representation of the fever and the illness. And then the Yin level is usually characterized by some of the more emotional symptoms and disturbances in sleep and more agitation. And then the blood level, which once it gets to the blood level, then the interior organs are most affected. There's usually, in Western medicine, that would be when we're looking at H. pylori or a strep, when that's kind of gotten very internal, and then we need to use different herbs to get there. So it's kind of based on how far this pathogen has progressed from the outside to the inside of the body. And the way we prevent the pathogen from doing the most damage is actually through a lot of preventative health of the lungs and of the digestive system. So if your body is strong, when that pathogen comes in to that first level, the Wei level, it's able to actually just kind of deal with it on its own. If your gut is in good health, if your lungs are in good health, you might not even know that you've defended off a pathogen. But if your interior system is a little weaker, that pathogen might get deeper and deeper. So what I like to do is just use herbs to make sure that we're defending against any of those pathogens, and we're also just strengthening the body and preventing disease.
That's really very interesting. How even with one illness like PANS and PANDAS, each person can have problems at a different level and might require completely different herbs.
Yeah.
And then on that, sometimes people have different constitutions, and they require even different herbs. Can you tell us a little bit about how the immune system works in traditional Chinese medicine? Because one of the problems with PANS and PANDAS is a dysregulated immune system. And how does Chinese medicine address that?
Yes. So the immune system, that Wei Qi, is actually supported a lot through the lungs and also through the digestion. And so where there's definitely a connection between those organs, between the lungs and what we call the spleen, stomach, and the kidneys, all of which kind of work together to ensure that we're able to defend against those pathogens that come into the body. But yeah, that connection between the nutritional aspect, and what we're looking at in Western medicine of working on the gut to kind of repair immunity, those two things actually correspond quite a bit to the way I'm seeing things when a client presents with symptoms.
Can you, so once you've found that this is the constitution of a person, this is the level of illness that they're having, what organ system is involved, then what does a treatment plan look like for you? If you have an example of how that.
Yeah, absolutely. So when we're talking about that way level, that very exterior, the level of the body, for example, and this can be applied to really anyone that gets sick, which is an interesting thing. When the symptoms are at the first stage, we're going to use spicy herbs to actually just push the pathogen out. Like when you think about eating spicy food, and then all this mucus comes out, that's actually your body just kind of like repairing itself. And so a lot of the herbs for that first level are going to be either spicy cool like mint, or spicy warm like cinnamon, and they're just going to help bring and detoxify the body and through the pores. Once it starts getting deeper into the body, we're going to have to also use herbs that sometimes drain pathogens through the urine. Sometimes we're also, and we'll definitely, actually in all cases, we're going to be looking at tonic herbs too, to strengthen the digestion and make sure the metabolism is working well. When the body's able to maximize its energy potential, that's also going to be preventative for infections down the road. So yeah, there's formulas. Once it gets to the blood level, there's formulas like this one example, Coptis Relief Toxicity Formula. That is for when the organs are seriously impacted by the pathogen, and that's going to clear heat, relieve toxicity. It's going to cool the blood. It's going to kind of remove the infection from the deeper levels of the body. And when we do that, that's definitely going to affect the emotions, and that's also definitely going to affect the digestion. So all of these things are really going to be working together and helping. And of course, I take the individual and their constitution into account. So yeah, depending on the person, I might use definitely different herbs, one person to another, because we are all different, and I like to, make sure that we're treating the individual in every case. So there are a lot of good herbs, and there are a lot of good options.
And one of the things that I really like about herbal medicine in general is the fact that all these herbs can be complementary to each other. So whereas in Western medicine, we use the concept of one medicine for one symptom and one disease, and we call it using a simple, if we use one herb as a simple. But in a lot of traditional uh, ways of prescribing or using herbs, there's a lot of combination of herbs that go together, and
Yes.
each one of them doing something different, and all of them add up to more than any individual herb would do. So this formula that you're talking about, the Coptis relief toxicity formula, is this also made of different herbs?
Yes, it is. This is a 6 herb combination. So we're going to have some herbs that are clearing heat and cooling the blood down. We're going to be having some that are moving substances through the body in the form of urine and kind of draining them out of the body. And yeah, that's kind of mainly, and clearing heat from the heart and the liver too, and that's going to like help with the anxiety and some of the emotional symptoms. But I really like that. I've always really liked the fact that there are a lot of herbs working together in these formulas. There's it's kind of like how we're all working as a team here in the clinic, and even the herbs themselves within individual formulas, they work together in these really beautiful harmonic ways. So yeah, it's this medicine is very, very beautiful, and there's I never get bored. There's always more to learn.
And the combinations are endless.
Yes.
Like even formulas like Coptis relief toxicity formula, my understanding is that you can really individualize this formula for any one individual by removing one herb or adding another herb, and that changes the whole mechanism of action for the herb.
Yes, absolutely. Everyone is different, but they're, no matter who you are, I really believe there are herbs that there's an herb for you out there for everyone. Because these herbs are also preventative too. We don't have to wait until we're very sick. These herbs, yeah, I mean, and no matter what culture we come from or where we are, herbs have been used as kind of daily practice and or daily medicine, just to keep us in good health. So, yeah.
Well, thank you so much, Audrey, for being with us and for sharing your knowledge with us. And I know we work closely in our clinic, in which we sometimes share patients, and it's a real privilege working with you. So this is an example of how our clinic works. And PANDAS is one condition that we work on. We still have other conversations that are awaiting us. We still have to talk with our psychologist about the mental health aspect of PANS and PANDAS and how we address that. We still have to talk about various accommodations that can happen, different types of psychological therapies that are available to help a child cope. So we are going to meet again. Thank you so much for joining us.
Thank you so much, Dr. Javed. It's definitely been wonderful to work with y'all and have this conversation. So take care.